Welcome to a Prevent Connect podcast, where we explore the prevention of violence against women. This is a project of the California Coalition Against Sexual Assault.
So despite 8 years of facilitating trainings, I have to admit I still get a little nervous when I have to engage in public speaking. That's okay. So when I do engage in public speaking, I typically bring a rubber band with me to play around with, and it definitely helps to calm my nerves. So when I started to write my notes for today's Ignite talk, I was playing around with my rubber band, and I realized that the rubber band is much like our sexual violence movement. It's basic science if you're a physicist, which I'm not, but if you are, you know this. If you're not, stick with me. When we expand the rubber band, we create force. It's storing potential energy. The further we expand, the greater our force, the greater our potential. We too are loaded with potential energy, just waiting to be unleashed. We just have to be willing to expand. This afternoon, I'm going to talk to you briefly about Delaware Coalition Against Domestic Violence's journey to engage men in sexual violence prevention and how we've been expanding that work. How we're strengthening our force to mobilize our partners who are striving to create the conditions where all people can be safe, happy, healthy, authentic, and truly thrive. How we're increasing our potential energy to end sexual violence. Like many others, DCADV has been engaging men in violence prevention since 2004. We started with a media campaign, 15 Leading Men, to recognize male allies willing to publicly denounce violence. Despite the nice marketing materials, guess what? Violence persisted. We had to expand. We needed more than 15 leading male allies championing this movement. We wanted to create conditions where boys and men critically examine gender, sexism, and patriarchy, root causes of violence. We wanted to create spaces for boys and men to liberate themselves from gender norms that are harmful to others and self. After a powerful event facilitated by Tony Porter in 2010, Delaware Men's Education Network was born. We had a crew of dedicated male allies who were creating the very conditions that we wanted to see for our boys and men to explore gender norms and their role in violence prevention. But we still had to expand because at that time, we were still really working on the individual and relationship level. And we knew that if we really wanted to increase our potential and our force, we had to move further upstream. So in 2004, DCADV received RPE funding, which allowed us to expand our efforts, moving from engaging individual men to engaging communities. Our small crew of individual men transformed into a statewide, diverse network of MOU partners who desired to learn more about prevention science, mobilize and engage their own boys and men, develop media messaging campaigns that promote healthy gender norms and social norms, and implement bystander intervention programs in their respective communities. Now, I became DCADV's Engaging Men project coordinator in August 2015. And prior to that, I was working at a university in Pennsylvania. I thought I'd easily transition into DCADV's RPE project because I was coming from a university where I was doing similar work. We were doing health promotion, we were doing violence prevention and gender equity work with much success. I thought it'd be simple. I was going to move to Delaware, this small little tiny state that I had never heard of before. Check. I was going to engage men. Check. And I was going to project coordinate. At the time, I didn't know what that meant, but check. It was easy enough, right? In my mind, I envisioned that I was going to channel this 2004 Oprah, Delaware style. You're getting engaged, you're getting engaged, you're all getting engaged. And us engaged people, we're going to end sexual violence in the state of Delaware one bystander intervention and media messaging campaign at a time. If only it was that simple, right? On September 14th, 2015, I was reminded that it's really not that simple. Not even a month on the job, Thomas Cottingham was murdered a block from my office, where you can see in the red. Right outside of my office, this beautiful black man was murdered as he attempted to save the life of a woman who was being attacked by a man with a knife. Thomas was an active bystander, doing what he perceived to be the right thing. He was doing what most bystander campaigns promote: see something, say something, or in this case, do something. I think everyone in this room knows that that work is not that simple. It's more than two call to action slapped on a bulletin board in our communities that are trying to survive while they're experiencing chronic adversity. Now, it should go without saying that this single incident wasn't the epiphany moment for our coalition that radically changed the trajectory of our work, but rather it was an unfortunate reminder that we had to do better, not just as a single coalition, but as a movement, to better understand how we can apply and promote our current prevention science in a way that authentically fits the context of the communities that we work with and their lived experiences. One size does not fit all. We had to expand. We had to address the historical and present-day relationships between oppression and sexual violence. We had to address how conditions, systems, and structures oppress individuals and communities and how this impacts our ability to effectively engage in primary prevention. We had to engage in some critical self-reflection as an organization about how we may be unintentionally reinforcing systems of oppression in our work. We had to explore what our role was as a mainstream organization in supporting the liberations of communities who were oppressed. And we had to do it in a way that was authentic, because the last thing that we wanted to do was colonize a framework and reduce it into a buzzword that might look nice on a strategic plan. Thank you for that. At DCADV, we believe that we can truly support and create the conditions where all people can be safe, happy, healthy, authentic, and truly thrive. We believe in primary prevention, and we know that it requires true social change to make that happen. We know that's a process of changing attitudes, beliefs, community norms, and social conditions that lead to violence. And we've gotten comfortable sitting with the discomfort that comes when you embark on a journey that requires individual and organizational self-critical reflection. We've gotten comfortable embracing the fact that social justice work is complex and it is messy, and we don't have all the answers or a nice toolkit to guide what we do. We've learned to accept the fact that people may not always understand why we're these fierce advocates for this social justice, feminist, anti-oppression, pro-liberation stuff, as some people may say. That people will ask us day in and day out, how is this relevant to sexual violence prevention, what you are funded to do? And our answer is, how is it not relevant? Oppression and health are intricately connected. Oppression is a social determinant of health. It's a societal level risk factor that manifests across all levels of the social ecology. It's a risk factor that we must address. It's the natural progression of our movement. We just have to be willing to expand, willing to unleash our potential. Thank you. So I look forward to engaging in dialogue with anyone who's able to join us at the round table in the choral room afterwards. And then for those who aren't, my information is on the screen. Please keep in touch with what we're doing down in that little state, the first state of Delaware. Thank you.
Thank you for listening to this Prevent Connect podcast. Prevent Connect is a project of the California Coalition Against Sexual Assault, with funding from the Centers for Disease Control and Prevention. The views presented on Prevent Connect are not necessarily the views of the United States government, the CDC, or CalCASA. To learn more about Prevent Connect, visit www.preventconnect.org. For more information about CalCASA's mission, or to show your support, visit calcasa.org. That's CalCasa.org.